Nancy, thank you so much for being here this morning. I guess we're approaching the afternoon shortly. And for those who don't know Nancy, she's Executive Vice President and Chief Advocacy Engagement Officer at AARP. And there is no better person to have with us this morning on the topic of caregiving than Nancy, both the work that's being done at AARP and just also her personal experience as well, and just both an informed and passionate leader on this issue. So thank you very, very much for being with us.
I'm thrilled to be here. Thank you. And very seldom do I get walk-up music, so it's really a treat.
Thank you. So I guess maybe just to lay the foundation a bit, if you can speak again for the years that you've been focusing on caregiving, how you see there's more awareness, attention that's come to the issue, but then at the same time, where there needs to be more, because I think as any of us know, whether or not we may at a point in our life be the recipients of caregiving, but also our role in caregiving to family and friends.
Yeah. Well, and again, thank you for having me, and thank you for bringing together people from across the health industry. It's so important for us to reach out, and I hope I can persuade some of you to bring this issue even higher on your agenda. I always start in a room. It's hard.
Very long, yes.
Long. You need the peripheral vision of Michael Jordan in here. So, how many of you have been, are, or expect to be family caregivers? Okay. Don't be offended by this. You're about average for the numbers, about 2/3. But it's a growing market. 55 million people over the age of 65 today. It's going to be 80 million roughly in 20 years. And people, this well, are living longer with chronic conditions that require care. And the world is changing. And the pitch we make is that this isn't just an issue for older people like me to focus on, but all ages. And I have a cartoon that I just want to kind of show, because this is the world I think we're entering. It says, we've changed our minds, two parents coming in to their kids' home. We do want to be a burden to you. And if that's not terrifying enough, I think you all probably know the statistics. We don't have to really get into them in great detail, but we do have a slide again that will show kind of the facts and figures. You asked a bit about the universe of family caregivers. There are 48 million today. Remarkably, that's 10 times the number of direct care workers. We've had a lot of discussion about direct care workers, but think about it being 10 times the number of direct care workers. 60% of caregivers are women, 40% people of color, 30% millennials or Gen Z, 20% are over the age of 65, and 30% are part of that very famous sandwich generation, caring for both a parent and a child. And the other important statistic, and while caregiving has become a little bit more focused on these days, is that 61% of family caregivers are also in the paid workforce. So it's not just an economic issue for individuals, but also increasingly an economic issue for businesses and employers. So it's big, mm-hmm. And we and others appreciate your interest. Are trying to make the point that family caregivers are the foundation of our long-term care system.
Mm-hmm. Nancy, can you speak to, at AARP, what priorities you're focusing on, policy, legislative, regulatory?
Sure. When we talked to family caregivers years ago about what they needed, it basically boiled down to, I need things that help me save time, save money, or get the resources, practical resources I need every single day. And as a result, we put together an agenda. Happy to talk more about what we've done over the years, but right now we're very focused within those areas in a few ways. First, we have pending right now 4 bills in the Congress. I'm going to look down at notes to refer to them so that I don't give you bad information. But 2 of them fall in the category of helping save money. One is a caregiving tax credit. The other is a bill lowering costs for Caregiving Act that will allow the use of HSAs, FSAs for caregiving expenses. Mm-hmm. The other two speak to saving me time, helping me maneuver through the system, connecting caregivers to Medicare Act requiring CMS to publicize the ability of Medicare beneficiaries to authorize a family caregiver access to records, and then alleviating barriers for Caregiving Act. This is our most popular bipartisan, bicameral bill. All of these are bipartisan, and that's because it reduces red tape, mm-hmm. and we all know about that. At the same time, we're working very hard to push CMS, and they've been very good on this, to implement the president's executive order from a year and a half ago. And the big breakthrough there is CMS has indicated that they will pay for healthcare providers to train family caregivers to provide care. We think this is absolutely recognition that the family caregiver is a new provider group in the healthcare system. Mm-hmm.
And with that recognition, do you feel that, again, looking at the state, local, federal level, that's recognition of the awareness that has occurred in realizing that this is a population that we need to be able to meet the needs of, and not, I mean, it's only going to grow.
Yeah. Well, it's been slow and steady. You and I have been in government. We've lived that. We started in earnest about 10 years ago. Mm-hmm. We did something big national organizations sometimes forget to do, and that's listen to your members. And what we found was calls to our call center, comments coming in through our bulletin and our magazine were mostly about challenges with caregiving. Mm-hmm. And so we began an agenda. In 10 years, we passed hundreds of bills at the state level, telehealth, respite care, any number. We started with a model bill called the CARE Act that some of you may know, we passed it in 45 states, requires, if you go into a hospital's required to identify your family caregiver. And then when you get discharged, the family caregiver also has to be given the instructions. And we all know the state you typically are in when you're discharged from the hospital. And so, when we first put it together, all organizations worry, is this something that's going to only play in a blue state or red state? It turned out first state to pass it was very red Oklahoma. Second state was my home state, blue New Jersey. And the third was purple state, Virginia. And so we knew at that point that there was recognition and that there was a willingness for policymakers to come together. Make no mistake, you know this as well as I do. It's very hard to move things, but we saw real progress at the state level. We didn't see as much progress at the federal level at the beginning. Mm-hmm.
Mm-hmm. Just jumping a bit to the intersection of caregiving and Medicare Advantage, ATI has done some research we're happy to share with anyone of interest, focusing on some of the kinds of services that are available. And it, can vary from, providing counseling to families so they know how to be playing that role as a caregiver. And the other are supplemental benefits, one of the many reasons seniors choose Medicare Advantage, and some of those benefits like nutrition, transportation are, tapped into by caregivers. But what do you see with your knowledge and experience of the kinds of services that are valued, but that also are needed, and there's gaps, and whether or not it's in Medicare or Medicare Advantage, but just for the senior population?
Well, I think those you just enumerated are all top of mind. And what we've seen is people are concerned about transportation services, not only for the caregiver to get around, but also for the patient. Safety and mobility, just what do I have to do to make my house safe? I had my own experience, Mary Beth knows this, my husband had ALS. We cared for him for 6 years in our home. and spent a lot of time thinking about in the beginning, are there grab bars? Are there things we can do to help him? And that is a big preoccupation among caregivers. Respite care is probably at the top of the list. And although many respite care programs have focused on giving people a weekend or several days, you'd be surprised. You talk to caregivers, they're looking for an afternoon or maybe a chance to just go have lunch with friends. And so respite care becomes increased. I can see people nodding their heads, you know of what I speak. And then to your point on counseling and red tape, how do you maneuver your way through the system? I am quite sure you and your members have a lot of inquiries about how do I figure out what benefits are available? How do I do what I need to do? Very common sense stuff, but the kinds of things that take people's time and wear them down.
Mm-hmm, mm-hmm. One area we're finding again with supplemental benefits is with the increase in the low income and diverse populations, Black, Latino, Asian American populations, and their dependence on Medicare Advantage. Can you speak to, and I can't remember, I apologize, in that first slide of those valuable stats, if that spoke to minority populations and what the breakdown was there. But I would think that there's much more of a need, as a lot of those diverse populations are in communities where they rely immediately on families, but at the same time, they may not have the resources.
Yeah. Well, I think clearly all family caregivers need help, and those who don't have resources or as many resources need even more help. Mm-hmm. And I think that is going to become even more apparent as one of the figures, 61% of family caregivers are in the workplace. Mm-hmm. That's the pressure on employers right now to provide some kind of flexibility, particularly important for low-income folks who need to work, need to be at their job. They aren't all blessed working for an organization, as I was, AARP. We have caregiving leave. We have very flexible work hours. There's no question if you need to go take care of somebody, we can make it work for you. That's not true for everyone in their jobs. And I think for organizations like yours that are serving low income, we probably should do even more to understand that if there are very special needs beyond the most obvious.
Mm-hmm. How do you manage communication challenges? I'm sort of shifting gears here, Nancy, because one of the areas we were just speaking with Jonathan Blum from CMS about the importance of not having complexity for seniors during open enrollment. And some of it is, and there may be other folks from the agent and broker community here, where there's a real reliance on agents and brokers to help those seniors navigate. But at the same time, we're trying to introduce certain standards so it doesn't get too confusing, and CMS is doing more to make sure that seniors aren't in any way being taken advantage of. But when you and I were talking about just bringing awareness to caregiving, and you talked about communication, it's sort of, it was how do you simplify it and what's the complexity, and also having the seniors know that caregiving's an option for them. So if you can just sort of speak to those communication issues.
Yeah, well, job one is always, how do we use language that real people can understand? Mm-hmm. And that's harder than it sounds. We all have our acronyms. We all have our terms. I had to ask Brendan about a couple of acronyms in a note he sent me to come over here. I thought, my gosh, if I didn't understand this, how would we communicate it? So I think we have to do that. And we actually spend a lot of time on message testing. Mm-hmm. What are the words that work with our constituency? And if you want to save your organizations a lot of resources, go to the AARP website, because every word we use typically has been message tested. So I just saved you a lot of investment in research. how to talk about various issues, how to put them in terms that at least older Americans will understand. So the first is the actual language. The second is who's the messenger. And we spend a lot of time thinking about that. We do a lot of teletown halls, for example, and we're always looking as we do it into targeted communities. If we're doing some with our younger members, I'm not always the best face for that. If we're doing something with our older members, it seems small, but just the credibility of the messenger is so important as we're communicating. And then third, what are the vehicles we have? What are the ways that we can connect the most with our constituency? We've really utilized teletown halls a lot. Call, get people on the line, have them listen in. Facebook Live works beautifully with older Americans. They're all there believing their grandkids are on Facebook. No grandkids are on Facebook anymore. But to utilize those methods, I was joking before when we were talking. I'm on Medicare, and I get, when you go to the doctor's office, you get the communication, usually about 5 letters for each visit, and you open it, and in the upper right-hand corner is the only thing anybody focuses on immediately. This is not a bill. And once you read that, there's space under it. And I was wondering, what a great place to send a message. I, of course, am not in the government, so I don't know if they can actually do that. But I think the point is we have to use all of these channels, and especially with older people, I think, and you may know this from your plans, actually being able to give a 1-800 number makes a big difference.
And who do you find are the most effective messengers? Not necessarily people at the highest level of an organization, and not necessarily someone that is deeply known in the community, but somebody people can relate to just almost instantly. And somebody who is often in our sessions, the people that get the highest grades are the people who do the Q&A and are willing to engage on questions and aren't dismissive, which is really important. Because that's something we do spend a lot of time on, and just, again, communication with Medicare Advantage beneficiaries is understanding, who do they, the level of trust and confidence. And sometimes that could be, the service organization, the aging organization, or their CBO on the ground. In some cases it can be their, physicians or representative from their plan, but it can just really vary, I think, depending on their issue. So I just sort of didn't know how that, varied. And again, sort of sticking with this theme of communication, how has it evolved with e-communication? And again, I know that your caregiving population, it's, not just seniors, it can start at any point in their life, but where has that presented opportunities, but then with sort of older seniors, it's still an obstacle, because that's, something with the services that we're providing Medicare Advantage beneficiaries, we're always focused on that.
Well, we found increasingly our members of all ages, obviously the younger ones are more likely to be online and use chat functions, but increasingly members at all ages are, and increasingly family caregivers are. Family members might be able to help out and do that. So as with many things, it always seems to be all of the above. That you have to do all of these things in order to reach people. And the other thing is, I don't know that we've perfected it, but I always try to say when we do a teletown hall or we do some kind of outreach, are we really using it as the opportunity to understand even more about what we're doing and what we need to do to serve our constituency? How can we use every interaction as an opportunity to learn? On our teletown halls that we do, typically, we do a number of them nationally, and we'll have 80 to 100,000 people on them. And it might be on an issue. We'll likely do one on Medicare enrollment, just providing information. And inevitably, you can only get to 10 or 15 questions in the course of the time. But what we found is that we have a tool to look at all of the questions that come in the queue and see what the common issues are. And then we're able to post answers to those issues. And we really use that as an opportunity to try to get a sense of where people are, what they're thinking about, maybe something that is helpful for the Med Advantage plans. You interact with so many people. The only other thing I'll say about communicating is we find the more local, the better. You talk about trust. Large national organizations, big organizations tend not to be as trusted as local organizations or even local messengers of those organizations.
There's sort of a constant theme here where as much as when we think, at least in the intersection of Medicare Advantage, you would think it's the focus of healthcare, but there's a lot in the caregiving that is in the non-medical care. So when you were just talking about it's, just the daycare or just help with in-home tasks, and then obviously, respite care. But is there anything that you think in, again, whether or not it's medical care or non-medical care, that in the space of Medicare Advantage, there could be more attention or more need because of where you see the demand and the utilization from caregivers?
Well, I do think, and this is why we're so pleased that CMS has talked about reimbursing for training. It is important for caregivers to be trained on various medical things. In my own case, we didn't have any real training on the feeding tube or the breathing machine, and we learned to operate both of them, terrifying though this is, with YouTube videos. Now, YouTube is great. I'm not casting aspersions on YouTube, but you probably want to have in place something beyond that on these kinds of medical tasks that people are increasingly provided. They're giving shots, they're managing feeding tubes, they're handling breathing machines, they're doing all of this kind of work, and being trained on it and confident in what they're doing is going to be hugely important. And I think that is something that, particularly with the CMS rule, will be something that the plans will be engaged in pretty directly.
And I know in the space of caregiving, it's a very nonpartisan issue because it affects everyone. But obviously, we're all in an environment right now where there's going to be some change in administration, whether or not it's President Trump or Vice President Harris. But as you think about that CMS rule and just the looking ahead to the next, 4 years, do you, what opportunities and challenges do you see? And never mind what, could change with Congress.
Yeah. Well, remarkably, I'm an optimist, even though my day job is advocacy in Washington, D.C. And I'm also a baseball fan, but not a Mets fan. But remember 1973, any of you remember the mantra? You gotta believe was and that's kind of my mantra on this. You gotta believe that an issue that affects so many people, including members of Congress, you can't go into a meeting and talk about it and not hear a story from a member of Congress. And I think that's why we have such strong bipartisan, bicameral support. It's still very, very hard to get things done, but that gives me some hope. Also, the fact that we have, as I mentioned earlier, some legislation that doesn't cost money is very common sense. I think we may be able to get that through, even if there's an end of year session, you never quite know. And the groundswell of support across the country. Part of my day job is to oversee our activists, 3 million rapidly engaged folks. And when we first started with our caregiving bills, we were really dubious about whether we'd be able to activate our members. We knew we could activate them broadly on Medicare, on Social Security, but caregivers are the busiest people on the face of the earth. Would we be able to get them to call their legislator? Would they go to an office? Would they do this? Well, it turns out the answer is yes. And part of that is the tremendous emotional stake they have in the issue. Part of it is a pocketbook issue, which is important. And so we've seen tremendous support. We did a little campaign a year ago called In My Shoes, prompted by some of our focus groups. I don't know if any of you saw them, with older women. Mm-hmm. And it blew us away, the number of older women, Republican, Democrat, Independent, who said, I don't feel elected officials have any idea what my life is like, any idea. And many of them said they didn't think people cared. And it really affected us. And somebody at the end of this focus group said, we need to talk to people so they can tell us what it's like to be in their shoes. Mm-hmm. And so we launched this online. We had 250,000 people gave us their stories within a week and a half. Now, we didn't think about what we were going to do with 250,000 stories, so that presented an immediate challenge, but just think of it. And that's why I do believe that we will make progress. But to your point, you and I have labored in these vineyards a lot of years. It's very tough. I just hope that the fact that this is an issue that virtually every member of Congress, everybody in CMS, everybody in the administration has either dealt with directly or indirectly will help us move it forward. So we're anxious to see and appreciate the interest and commitment and from MedAdvantage. I think these supplemental benefits are so important, and you will have a view of what people want and what they care about, and bringing that information into the debate, showing us what you're learning and what people are telling you is going to be so important for our future success. So delighted you're doing this work.
Well, thank you for bringing the awareness and the action. I know we've talked a bit about awareness, but everything that you just shared with your work with the Hill and the administration and CMS is also showing that action. And so whatever we can be doing, and appreciate the interest to be able to, see what we can learn from our Medicare Advantage beneficiaries and their reliance on that caregiving. So appreciate the opportunity to collaborate there.
Great.
Thank you, Nancy.
Great. Thank you. Thank you, everybody, for being here.